Welcome to the Nushi Health Podcast, where we provide credible, no-hype health, wellness, and nutrition information that actually moves the needle towards better long-term health. Welcome to episode 9 of the Nushi Health Podcast. I'm your host, Dr. Erin Glenn. Today, we're kicking off a new series of episodes focused on action, changes you can make to have a large impact on your metabolic health. Some of these are going to be small, relatively easy tweaks you can implement right away, and some take a little bit more of a commitment. In any case, the goal is to arm you with all the evidence-based tools we have to improve 4 key areas of cardiometabolic health: blood sugar, blood lipids like triglycerides and cholesterol levels, body fat, importantly, the weight that's carried around your midsection, and blood pressure. In the upcoming episodes, we're going to take a look at these areas one by one and focus in on key actions you can take immediately to start moving the needle towards better numbers, questions to discuss with your doctor and tests you may want to request, and longer-term strategies to get to and maintain healthy levels in each of these categories. We know from several recent studies on national health data that only about 10% of American adults are considered metabolically healthy. This has been defined slightly differently depending on the study, but the key factors are the same. It's about having optimal levels or measures in each of those 4 areas: blood sugar, blood lipids, blood pressure, and body fat or adiposity. What's optimal? We'll get into more specifics on each of these in the episodes dedicated to each area. But for today, general optimal levels have been defined as the following: fasting plasma glucose less than 100 milligrams per deciliter, and HbA1c, which represents about a 3-month average of blood sugar levels. We want HbA1c less than 5.7%. For blood lipids, we can look at a few measures. Triglycerides, we're looking for less than 150 milligrams per deciliter. And for HDL, a type of cholesterol, we actually want that number to be higher. So we want 40 milligrams per deciliter or more for men and greater than 50 milligrams per deciliter for women. We also want the ratio of total cholesterol to HDL cholesterol to be less than 3.5 to 1. Waist circumference is a measure that correlates to the fat carried around your midsection. And this measure is important because visceral adiposity, that specific type of fat around the midsection, is a risk factor for many chronic diseases. We're aiming for waist circumference less than about 40 inches for men and less than about 35 inches for women. We can also consider body mass index or BMI here, but I like waist circumference and waist to hip ratio more than BMI. And we'll delve into those differentiations in episode 12. Lastly, you're probably aware of the healthy blood pressure numbers, as these are pretty standard. You want to be less than 120/80, and that's in millimeters mercury for your blood pressure reading. Those are the main targets we're aiming for in each area of cardiometabolic health. And we'll get into more details as we cover each area individually, specifically how to find out your levels or measures of each of these and how to course correct if needed. The good news is, many of these tests are often run at an annual physical, but if you don't have access to that, there are many companies now that you can purchase an at-home test kit for a reasonable cost to find out your numbers. The ultimate goal is to be in the healthy, optimal range for each of these parameters without the use of medications. If that feels like a lofty goal right now, that's okay. I hope learning about some of these small actions you can take today will help get you started. It's all about taking that first step and consistently taking steps in the right direction, even if they're small steps. Small steps forward are better than staying where you are or going backwards. Today, I'm going to share my top simple tips for changes you can implement immediately and with little effort that can make a big difference. I'm not going to weigh you down in the science today. We'll get into more details about how the different recommendations can work to improve each of the 4 areas of metabolic health in the next 4 episodes. Today, I want to keep it simple and actionable. But first, I want to discuss why improving our metabolic health as a group, as a society, is so critically important. And to do so, we're going to run through some national statistics. We know that over 50% of American adults today have prediabetes or diabetes. 38% have prediabetes and just under 15% have diabetes. These percentages only increase with age. Over 78% of people who are over the age of 65 have prediabetes or diabetes. Think about that for a moment. Almost 80% of our population on Medicare in the United States have prediabetes or diabetes. And we see the effects of this in our healthcare spending. 90% of the $4.5 trillion that we spend every year on healthcare in the US is going to treat individuals with chronic diseases and mental health conditions. So if you're concerned about our national spending and budget and debt, we have to think about the impact that improving metabolic health as a society could have on these numbers. One statistic I saw that was really surprising to me is that less than 20% of those with prediabetes actually know they have prediabetes. So we know about every 4 in 10 American adults have prediabetes. 3 out of 4 of those people don't know they have it. And this is important because if you don't know, you're likely not taking steps to change that trajectory. Those numbers are just for US adults. The number of kids and teens with metabolic health concerns also continues to grow each year. Some estimates as high as 30% of teens being pre-diabetic. We know the US spends twice as much as other wealthy nations on healthcare each year. And with the introduction of GLP-1 drugs at a list price of about $1,000 a month, our healthcare spending is only expected to continue its upward trajectory. I share these numbers not to scare anyone or shame anyone. I share them because they were staggering to me, and I hope they are to you as well. We are on this path that we don't have to be on. We're getting sicker each year, and that toll is felt in our homes, in our workplaces, in our healthcare system, in our economy, really as a nation. This issue is affecting us all, and whether you're part of that 10% of metabolically healthy or 90% of us that have some room to improve our health, we're all in this together. So with that, I want to share 7 tips you can start today, many of which will impact your metabolic health immediately. These tips are meant to be small and actionable, things you could start today without a ton of effort. The first has to do with blood sugar. We know that spiking your blood sugar from a meal or a snack can then lead to a crash where your blood sugar dips below normal or baseline levels. In a study where they used continuous glucose monitors on people, they showed that a drop in blood sugar after a large spike predicted how much food people ate in the next 24 hours, meaning if you spike your blood sugar often by eating these high carbohydrate, sugary foods and snacks, you'll likely eat more food throughout the day and crave more carbohydrates and more sugar. The solution? Try not to eat carbohydrates by themselves, especially simple carbohydrates like very sugary processed options. You really want to have some fiber, potentially some healthy fat prior to consuming your carbohydrates because that's going to slow the rate of absorption of that sugar. You don't ever want to eat something really high in simple sugars like a donut, for instance, by itself without getting some fiber, fat, and/or protein beforehand. That simple act will drastically change how your body responds to the donut. Another implication of this, if you want to have something sweet, is to have it at the end of a meal versus on its own or at the beginning. Having fiber, fat, and protein in your stomach before consuming sweets is going to reduce the blood sugar spike and prevent those crashes. If you're going to have something high in carbohydrates or sugars, aim to precede it with a salad or vegetables with some olive oil or even a fiber supplement. So that's tip 1. Tip 2. Movement has a massive impact on glucose disposal, getting that sugar out of your blood into your muscles. We know that being sedentary most of the day has huge negative effects on our metabolism, and studies are now showing that moving just 2 to 3 minutes every 30 minutes can actually have a greater effect on metabolic health than doing a 60-minute exercise session, but then being sedentary the rest of the day. So the action: aim to get up and move your body, preferably every 30 minutes, but definitely every 60 minutes, just a couple of minutes of movement. Moving your muscles after a meal can also reduce the post-meal glucose spike by up to 30%. So take a short 10-minute walk after your meals, or put on some music and have a 10-minute dance party. You don't have to go outside, but if you're able to get outside a few times a day and walk, even better. That getting outside has a host of additional benefits as well. We should all be aiming for 7,000 to 8,000 steps per day, and these short bursts of movement will really add up to help you hit that goal. Third, try to add some fermented foods every day. These are things like sauerkraut, kimchi, natto, miso, and no sugar added Greek yogurt. You can start with just 1 serving a day and work your way up to 2 or 3 servings per day. This will really help support your gut bacteria, which is intricately linked with so many aspects of metabolism. Fourth, aim to shorten the number of hours you consume food or calories each day. This is a form of intermittent fasting called time-restricted eating. Most Americans eat 13 to 15 hours a day. Aim to consume your food within a 12-hour window if it's safe to do so. We did an entire episode on this, so please check out episode 3 on intermittent fasting for a full rundown if this is one you're interested to try. Related to shortening your eating window, if you stop consuming calories both from food and beverages 3 to 4 hours before bed, this can drastically improve your sleep, your metabolism, and your metabolic health. The last few are going to be a little less popular, but are important nonetheless. Processed food. Take an assessment of how much processed food you're really eating and aim to cut some of it out. Are you eating a bag of chips or crackers or something like that for a snack every day? Grab an apple and some almonds instead. Eating foods in their whole form is going to provide so many more nutrients, make you much more satiated, and give your body what it needs to function optimally versus the ultra-processed foods that we consume so much of. I know it's hard, but start small. Focus on easy swaps like your snacks, your breakfast, and build up from there. The first step is awareness of how much processed food you're truly consuming. Smoking and alcohol. If you smoke, you are probably told often that it would be in your best health interest to stop. So I'm not going to linger on this one, but yes, please try to get some help with quitting. I'll post a few resources in the show notes. The same with alcohol. Occasional consumption is one thing, but heavy drinking is a killer for your liver and your metabolic health. And lastly, prioritize sleep. I understand this can be a challenge, but you need to focus on controlling what you can with regard to sleep. Make your sleep area as dark as possible and/or wear a sleep mask. Minimize distractions by silencing your phone and setting boundaries within your family. You want to aim to go to bed and wake up at the same time every day, plus or minus about 30 minutes. Sleep is such a critical process. We have to protect it. I promise your dog will get over not getting to sleep with you if he's the reason you're waking up 5 times during the night. We must prioritize our sleep. We'll go into more detail on the why behind these tips and many more that we'll cover in the upcoming episodes. But I hope that gives you a good place to start today. Aim to move more throughout the day, move your body after meals. Don't eat high carbohydrate or sugary foods alone or at the start of the meal. Get some fiber, some healthy fat and/or protein first. Eat more fermented foods. Eat in fewer hours of the day and aim to stop eating and drinking calories 3 to 4 hours before bed. Eat more whole foods, control alcohol consumption, and reduce or stop smoking, and prioritize your sleep. Those 7 actions will have a massive impact on your metabolic health, and we'll look at more strategies specific to each of those 4 areas of cardiometabolic health in the coming weeks. We did an introduction to many of the terms used in today's episode in the first episode, episode 1 of the Nuchi Health podcast. So if some of these terms were unfamiliar to you, I encourage you to check out that episode as well for a nice overview and introduction to nutrition. I hope you learned something new and you feel you have a few new tools to implement that will start improving your health. Please leave any questions or comments you have about today's episode in the comments section of our YouTube channel. You can find us at Nuchi Health, that's Nuchi Health, there and on all social platforms. And if you learned something helpful or enjoyed this episode, please subscribe to our YouTube channel, follow us on our social accounts, and leave us a review on Apple or Spotify. Those interactions help us grow and help us make a bigger impact. I've also linked my Ko-fi page in the show notes where you can make a contribution to the show if you'd like to support us in that way. Thank you for being here, for your desire to learn and improve your health, and for letting us be part of that health journey. I'll see you soon.